Hello everyone, welcome to October edition of the SSAT Resident Corner. My name is Maitham A Moslim. I am a second year general surgery resident at Cleveland Clinic. We will talk today about how to make a good presentation, particularly to an audience of physicians. Today I am meeting Dr. Matthew Kroh. In addition to Dr. Kroh's duty as the Director of Surgical Endoscopy here at the Cleveland Clinic, he's also an associate professor at Cleveland Clinic Lerner College of Medicine and a member of the Education Committee, where he supervises and mentors medical students and residents during their professional development. How are you doing today, Dr. Kroh?
Fine, thanks, Maitham.
Thank you for coming today. The ability to effectively and clearly present information is one of the skills that any resident must acquire. Indeed, it's an art none of us was born with, thought with training we can master it. I believe, Dr. Kroh, as a resident, we have the chance to present at national meetings and also sometimes during mortality and morbidity conferences. Some educators says that it's all about the presenter, how the resident or the physician on the podium or at the poster can pursue his audience and get his message across. But to be honest, it depends most of the time also on the subject that he's presenting on the audience as well. What are your thoughts about this?
Well, it's important to consider all those things. So when you're given a talk to present, you have to remember that you've been chosen to do that because presumably you're the expert on that. So whether it's data that you're presenting at a scientific meeting, or the body of work that you've done, it's your opportunity to communicate with others what you have discovered or what you know. In doing so, you have to know who you're talking to. So what is your audience? Are they students? Is it the public? Are they your colleagues, or are they national and international professors? It's a great opportunity to showcase what you know, but in order to do that well, you have to know your audience, you have to know what the goals of that presentation are, and then really what you want to get across during that discussion.
So I believe most of the residents, when they submit their paper and get it accepted, they have plenty of time to prepare for the presentation. In your experience, when you get called to present or have a poster, how do you get yourself prepared for it? Do you start preparing from now, or you just wait until you are close to the meeting and then you start preparing for it?
Well, on some level, you've been preparing for this for a long period of time. So it's part of your training to get there. It's part of your research that you've done up to that point. So you have a baseline knowledge and expertise, which is probably why you were asked to do that. It may be the sum of your research work or your experience through the years. Once you have been asked to do that, it's important to figure out what forum you'll be presenting in. If it's in a session at a scientific meeting, like Digestive Disease Week, what will the other presenters be presenting? You don't want to overlap with them. It's going to be very clear to make sure that you have a focus that won't be covered by others. And you want to make sure that you have a very clear and relatively simple message to get across. So it's very important up front to set expectations, the goals of your talk, and let your audience know that. To give them data, to give them more additional information to support what your expectations are of them, and at the end to summarize it all to make sure that they have some very coherent points to go home with.
Yeah, and you mentioned a very valid point about the audience. I believe the presenter, very important to know how much knowledge they have about the subject he's presenting. When you start your talk, do you try to appreciate their knowledge by asking them questions, or do you think that sometimes it's better to give them the talk and at the end of it give them a time for the questions, and by this you can appreciate how they could get from your discussion?
I think both are possibilities, and it depends on the forum. So if you're at a smaller conference where there may only be a handful of people in the audience, maybe half a dozen or so, then it's reasonable to ask them specific questions. What are their experiences? Do they have any baseline knowledge of what you're talking about? But that's probably unreasonable in a big session of 50, 100, or 200 people. And at that point, you'll be basically relaying information. But it's also very important to remember at the end, there's often an opportunity for questions from the audience, and that's a better opportunity for exchange. So it may not be up front for you to ask questions of them in the first place, but at the end there will be opportunity for an exchange of additional information that may not have been clear or are questions beyond what was presented.
It's been shown that the audience attention during a talk falls over the first 20 minutes, never to recover until the end of the seminar when you give the summaries. And it's kind of challenging, I think, for the presenter to keep them interested in his subject. So what's your tips to keep the audience engaged and never to lose their attention to what you're presenting?
Sure. I think the most important thing is to be enthusiastic, to be clear, and to present with a passion. But in order to do that, you also have to convey specific information. So there are specific suggestions that I have which can also help relay your information in a clear, concise way that won't overwhelm the audience. So when you're making slides, don't put too many points on any individual slide. You can augment what is on your slides with your speech. And therefore the audience has a visual to look at, but also can hear you speak as well. And it shouldn't be too dominant either words on a slide or your speech. And slide information can also be better imparted by adding cartoons, diagram, or video, so that it's a multimedia way in which you can get your point across, not spending too much time on any one of those areas, but allowing them all to come together in a more coherent and dynamic way.
I think that's a very valid point, because most of the authors says that during a presentation, multimedia account for 80% of how the audience interpret your message, and it's only hearing is account for 11%. So I think it's kind of important about getting multimedia involved in this. What do you think is more involving the audience? Is it presenting the multimedia and discuss it at the same time, or just give the talk and then present the video afterwards and let them watch it for a while?
It depends on the type of information you're trying to convey. Obviously, if you're relaying results of a scientific study per se, you won't really have video to go with that. So it may be tables, it may be additional information that comes in words, but it's up to you to convey that in a way that is accessible to people. Now, if the form is a technical presentation, then certainly cartoons and video are great ways to relay that, much simpler and more impactful than words might be. So it depends on what the goal of the discussion is and the type of information you're trying to convey.
Okay. How do you manage your time during presentation? I think it's kind of impossible to keep eye on the watch during being on the podium or during poster presentation. Is there any trick, any tips for that?
Sure, that's very important, and it's part of the skill set to giving good presentations.
Yeah.
So you'll be given an allotted amount of time to give your presentation. Be very mindful of that, because you're probably going to be in a session where there will be other presenters, and you don't want to impinge on their opportunity to present as well. And at a big meeting like DDW, there'll be hundreds of presentations, and it's very important to stick to the timeline that's been given to you so that the session can proceed appropriately. The way that you make that work is to practice ahead of time, get your timing down, present to others, whether that's your colleagues in the hospital. Here at the Cleveland Clinic, we'll take time prior to a meeting and have the residents and fellows present to each other so that we can give them feedback, work on their timing, work on their presentation, and any questions that they might have. So practice really lets you get that timing down and make sure that you adhere to what the expectations of that session are.
I think that's a great point, because when we prepared to DW before we did that session, it was very helpful. I think also to add on this, I think also videotaping yourself and then kind of criticize yourself or present to one of your family member afterwards to see how you did. It's kind of also a valid and good way to improve yourself. What do you think the best way to finalize or close up your talk? Is it giving a bullet summary about the subject you presented, or just give more time for the audience to ask questions?
Hopefully at the beginning of your talk, you have set some goals. You've given information about whatever topic you've presented. When the time comes to finish your discussion, you want to go back to those initial goals and make sure that you covered them. It won't be exactly the same bullet points, but now instead of broad concepts, you'll have very specific pieces of information that you'd like to summarize and allow your audience to go home with them. So it should be several bullet points that are very clear not an exhaustive rehash of what you've been talking about during the entire time of your presentation, but a few points that will be very discrete morsels of information for the audience to take home.
I think during any speech now, the trend is to get some kind of feedback at the end of the speech. And in meetings like DDW, it can vary from, the audience number can vary from 50 physicians attending to 500, and it depends on how popular the talk is. What do you think the best way to manage to get a feedback? And I think it's very important for the presenter to know what they think about his presentation, if there is any feedback, any helpful point that can help him in the research in the future.
You know, the best opportunity are questions from the audience.
Okay.
So hopefully there's an opportunity after your presentation for a back and forth discussion. And maybe immediately after your presentation or after several presenters have gone, and there may be a panel to whom questions will be asked. That will allow you to gauge the impact of your presentation, the engagement of the audience based on the number of questions you get, and then how clear your messages were in the first place.
And do you leave any contact numbers at the end of your presentation on your slides just to let them know you better and maybe contact you in the future?
That's a great idea. You know, at a scientific forum like DDW, there are many other engaged physicians and investigators that may have similar interests. It's an opportunity to exchange information and to grow the field as a whole.
I have another question related, and specifically we see it here in our program. It's kind of related to me very closely. We have at least 20% of our residents here from international medical graduate, basically, and they are non-native English speaker. And what do you think the most challenging experience that might have during their first presentation? Is it the stage fright? Is it how to manage to present in a clear way? Or is there any other tips, any other recommendation from your side for them?
I think for the most part, it's the same for any novice presenter.
Yeah.
Understand that you are potentially the expert in the room, knowing your material and being able to convey that in a clear and concise way. Now for non-native speakers, that may be more difficult because command of English may be more challenging, but the advice is the same. Practice with your peers, with your family members, with your mentors so that you feel comfortable, that you can relay your message and make an impact.
Okay, thank you very much for your time, Dr. Kroh, today.
Thanks, Maitham.
Thank you. Thank you everyone for watching this edition of the SSAT Resident Corner. I hope we made a good presentation. As always, we appreciate your feedback. Again, this is Maitham A Moslim from Cleveland Clinic. All the best.